Okay, here we go.
Hi, my name is Katy Farmerie and I'm doing a speech on fetal alcohol spectrum disorders, and I decided to choose this speech topic because I work as a personal care assistant for a 14-year-old girl named Amber who suffers from fetal alcohol syndrome. So I'm going to be discussing the general definition, the symptoms, the causes and complications, the pathology, the treatments, and the risk factors for FASD. So fetal alcohol spectrum disorders can be defined as a group of conditions that arise from a woman's consumption of alcohol during her pregnancy. According to PubMed, FASD is prevalent in 9 in every 1,000 births, which makes it the most common cause for developmental and intellectual disabilities in the United States. And due to the range of severity in this disease, it often goes undiagnosed or is diagnosed much later in the individual's life. So the Journal of the Royal Society of Medicine describes some physical symptoms of FASD that include a small head, short nose, low nasal bridge, along with many others. And I printed out a picture to show some of this. And the symptoms are really going to vary in severity due to the individual and how they react to it. So Simone Biles' mother drank during her pregnancy, but she shows almost no symptoms, while Amber's mother also drank during her pregnancy, and she's going to exhibit almost all of the symptoms of FASD. And so a lot of the times, these people are going to suffer from intelligence problems. So Amber's 14, but she's not able to solve a puzzle by herself, or she needs assistance making her bed. And they're often going to suffer from behavioral problems. So Amber will laugh hysterically at times when it's really inappropriate to do so, or she has a really hard time talking to her peers and having a conversation with them. And according to an article from Science Direct, some complications of FASD include anxiety, OCD, PTSD, ADHD, seizures, and a lot of the times these people are going to have a vitamin deficiency, and oftentimes they're going to have low carnitine levels, which takes a part in energy metabolism, so they're not going to be able to metabolize medications or foods correctly, which is going to lead to constipation, irritability, sometimes depression. And this is caused by a mother who is pregnant with a fetus being introduced to teratogens such as alcohol, illegal drugs, legal drugs, and environmental toxins. And there's been a lot of controversy in regards to the existence of this disease since it affects individuals very differently, such as Simone Biles and Amber. But studies have been shown that exposure to ethanol very early on in a pregnancy can cause depletions of large neurons in the brain, and interneuron connections can be damaged even at low levels of alcohol consumption. And a variety of different drugs can be used to treat some of the ailments caused by FASD, such as selective serotonin reuptake inhibitors, antipsychotic drugs, seizure medications, and exercise, water, and a good diet is going to help with a lot of the side effects that come hand in hand with taking these medications. And the risk factors for this disease is going to be related to a high blood alcohol content in the mother's bloodstream. So when the mother goes out and binge drinks, which has 4 or more drinks, and then goes through withdrawal, then that's going to take a really large toll on fetal development. And a high maternal age and a lower education level is also going to be a very big risk factor for this disease. But it's hard to determine risk factors since it affects victims and people very, very differently. But one thing to take away from this is that it's important to provide expectant mothers with education and counseling on FASD and how it can affect their unborn child, because this is a disease that is completely preventable.